Hello everyone, I am back in front of you with a new video, and in this video I am going to be discussing a very important matter. Undocumented immigrants are visiting the emergency departments of American hospitals. The question is, who will pay the bills? Who will pay the bills for the healthcare services that the undocumented immigrants receive? While many American citizens are struggling to pay for health care, undocumented immigrants are receiving services in emergency rooms. But before we get to the discussion of undocumented immigrants visiting American hospitals and emergency departments, let's give you an overview of the challenges that US citizens face in the country's healthcare system. My friends, we all know that healthcare expenses are rising. Health insurance premiums are also going up. And there is no doubt that healthcare is a basic necessity. Just like food, clothing, and shelter, healthcare is also a basic necessity. And it is also not a secret that paying for healthcare services can be very challenging for American families. Americans are facing rising healthcare costs. Many people do not seek medical attention for symptoms that they are facing because they are afraid that they cannot afford to pay the medical bills. So people forego care, and then their symptoms may worsen. Many American children living in poverty do not have access to high quality medical care, and many seniors are so frail that they are so frail that going from their residence to the clinic or hospital can be very difficult for them. Who will take the elderly individuals to their medical appointments? If you are paying attention to what's happening in the healthcare system, then you know that there's a shortage of caregivers. Health insurance premiums are increasing, as I already mentioned, and also for various health insurance plans, healthcare co-pays for doctor visits are also going up. Many Americans go bankrupt if they fail to pay their medical bills. A single episode of catastrophic illness can result in bankruptcy, and that is very unfortunate, but it does happen. It happens all the time. A person or an entire family can be devastated after one hospitalization. Medical bills after medical bills from the facility, from the doctors, can pile up and result in thousands and tens of thousands and sometimes even hundreds of thousands of dollars in medical charges. And my friends, there are undocumented immigrants. Now let's go back to what I was saying. And we understand all these problems that people are facing in America. And then there are undocumented immigrants who are showing up in emergency rooms and they're seeking medical care, and they don't have the means. Many of them don't have the means to pay for the services that they receive. And so the bills may go unpaid, which then hurts the overall healthcare system that American citizens depend on. I'll share with you a few reports that I read. So the first one is from California. In Chula Vista, California, close to the US-Mexico border, hospitals reported increased number of migrants showing up in emergency departments. In New York City, in the past year, medical centers in 5 boroughs of New York City received close to 30,000 visits from undocumented immigrants. In Colorado, a healthcare system reported seeing a huge increase in emergency room visits from individuals who are likely undocumented immigrants. The hospital said that they don't ask patients about their immigration status, but it is believed that a lot of the individuals seeking care in the emergency room are migrants because they have traveled from the southern border. They are uninsured, and many of these individuals have health problems that they may have developed during a long journey. And we know that many migrants coming from various parts of the world travel long distances to get to the US-Mexico border before they cross the border and enter the United States. Undocumented immigrants are seeking care at American hospitals while American citizens struggle to afford the medical services that they need. My friends, if you are an American citizen, ask yourself, is your health insurance premium going up for 2024, for the new year? Ask yourself, is your copay going up? How much is your deductible? Take a look at your health insurance plan for 2024 and see what your deductible is. Let me tell you that we all want to be healthy, but ensuring good health doesn't only mean going to the doctor and getting the services that you need. You also have to ensure a decent lifestyle. To have good health, you need to have a decent lifestyle. And having a decent lifestyle, having a healthy life means eating good quality produce, good quality meat, good quality poultry, and perhaps organic food. Many people choose to have organic food to ensure good health. And ensuring good health also means living in good housing that's free from mold, for example. Ensuring good health means having access to clean drinking water. Ensuring good health may also mean finding the time to do exercise, perhaps going to a gym. And if you are working 2 or 3 jobs to keep up with rising expenses, then you probably don't have the time to go to the gym. You probably don't have the time to work out even at home. And if you're struggling to pay your bills, you're probably very stressed, which may mean that your overall health may be adversely impacted. And if you are an American citizen working hard and sleeping less, then that may mean that there's risk of developing various health problems. And Americans are stressed because of the overall economic climate. There's a widespread economic uncertainty, and there are illegal immigration problems that our country is facing, and there are so many other issues in society. And many Americans are under a lot of stress, and they do not get adequate sleep. Diabetes, high cholesterol, and hypertension are some problems that are very common in the US population. And with rising prices in the economy and growing uncertainty and growing uncertainty in the overall economy, and people facing many financial problems, cases of diabetes and high cholesterol and hypertension may increase even further. These problems may worsen as people face a lot of stress in their lives. And now, on top of all the issues that we face, there is growing pressure on the American healthcare system because of the influx of millions of undocumented immigrants. And let's not forget that with the influx of millions of undocumented immigrants, there are new contagious illnesses spreading in the country. A rise in cases of respiratory illnesses have been reported, which is putting further pressure on the American healthcare system that US citizens and legal immigrants rely on. US citizens as well as legal immigrants rely on the American healthcare system. I understand that people need healthcare because it is a basic necessity, as I mentioned. But when the southern border is open and millions of people, millions of foreign nationals are walking into the United States without visa, without legal authorization, and we don't know where they are coming from, we don't know their background, and massive number of migrants end up in emergency rooms, the American healthcare system struggles to absorb this sudden shock. As millions and millions of undocumented immigrants are entering our country, and as many people are going to the emergency room, many of the migrants are going to the emergency room to seek medical care, the American healthcare system is going through a shock, and it becomes difficult for the system to deal with this shock, to absorb this shock. And as I said, many bills go unpaid. If the stability of our nation's healthcare system is affected, then that hurts everyone. My friends, we welcome immigrants as long as they follow our nation's immigration laws and enter legally. When foreign nationals follow and they respect our nation's immigration laws and they come in legally, they come in through a proper process, and after arriving in the US, they may seek a job, they may find stable housing, they may start paying taxes and contributing to the success of our economy, and they may obtain health insurance coverage. And there's a proper system that they go through. But uncontrolled and massive illegal immigration hurts our country, because now millions of foreign nationals are entering our country and they don't have health insurance coverage. They don't have the ability to legally work in the United States because they don't have legal status in this country. And that shocks our economy, and that shocks our American healthcare system. And that's exactly what we are witnessing right now. We are witnessing chaos. We are witnessing disorder. We are witnessing how emergency rooms at American hospitals are filling up with undocumented immigrants with a wide range of health conditions and illnesses, but without health insurance coverage. My friends, we are facing tremendous challenges in our country, and I have been discussing many of the issues on my YouTube channel. I want to thank you all for watching my YouTube videos. Please share with me your thoughts and comments. You can go to my website. You can comment on this video, but you can also go to my website, tausifanam.net, and you can send me a message. You can stay connected with me. You can also sign up for my e-newsletter. Please let me know what you are seeing in your community. If you live in a place like New York City or Los Angeles or San Francisco or Chicago or Denver, what are you witnessing in your community in terms of the arrival of undocumented immigrants? Please share with me your thoughts, your experience. I'm looking forward to hearing from you. Thanks once again for watching my videos, and I hope to be back again with new videos and with lots more information and commentary. Thank you.